Welcome back to Talk Tickers, the show where we delve into earnings calls and really try to figure out what's going on with these businesses. We've got a great one for you today. UnitedHealth Group just released their Q4 and full year 2024 results.
Yeah, it's always interesting to see what UNH is up to. They're a real powerhouse in the healthcare industry.
No kidding. They pulled in a staggering $400 billion in revenue for 2024. That's billion with a B.
It's pretty remarkable, especially when you consider the challenges they face this year.
Oh, yeah, for sure. They had to deal with Medicare rate cuts, the whole Medicaid redetermination situation, and even a cyber attack.
Yeah, it's like they were running an obstacle course, but they still managed to deliver an adjusted EPS of $27.66, which was right in line with their guidance.
It really shows their resilience and their ability to adapt to a changing environment. It makes you wonder how they do it.
Well, I think a big part of it is their focus on the future. They're not just reacting to challenges. They're actively reshaping the company for long-term growth.
Yeah, and that's really apparent when you look at their different business segments. Let's start with Optum Health, their care delivery arm. They hit about $105 billion in revenue in 2024, and they're projecting to reach $117 billion in 2025.
Yeah, that's some serious growth. And a big part of it is their emphasis on value-based care.
Value-based care. That's a term we hear a lot these days. But what does it actually mean in practice?
Well, it's essentially a shift away from the traditional fee-for-service model where providers are paid for each service they perform. Instead, value-based care focuses on paying for outcomes. So providers are rewarded for keeping patients healthy and achieving good results.
So it's like incentivizing your mechanic to keep your car running smoothly instead of just fixing it when it breaks down. I like that analogy.
Yeah, it makes sense. And UNH is getting big on this model. They're projecting to serve around 5.4 million patients in value-based care arrangements in 2025.
Wow, that's a significant number.
Yeah.
But does it really work? I mean, is it actually delivering better outcomes and lower costs?
That's the big question, and UNH is investing heavily to find out. They're putting a lot of resources into clinical quality improvements and the Medicare Advantage STARS program, which rates the quality of health plans.
So they're really trying to prove that this model can deliver. It's a long-term play. But if it pays off, it could be a game changer for the healthcare industry.
Absolutely. And it's not just about the numbers, it's also about creating a better experience for patients. Value-based care is all about keeping people healthy and out of the hospital, which is something we can all appreciate.
Definitely. Okay, so UNH is going all in on value-based care, but they're also making some interesting moves within Optum Health, like de-emphasizing standalone urgent care facilities.
Yeah, that's right. They're choosing to integrate urgent care into existing clinics, which makes sense from an efficiency standpoint.
Yeah, it's all about creating a more seamless and integrated care experience for patients.
Exactly. All right, let's move on to Optum Rx, their pharmacy benefit management business. This segment generated over $130 billion in revenue in 2024 and is projected to hit $146 billion in 2025.
Wow, those are some impressive numbers. What's driving that kind of growth?
Well, for one thing, they're the largest PBM in the country, and they've been very successful at attracting new clients. In 2024, they added 750 new clients, representing 1.6 million new consumers, and they have a 98% customer retention rate.
That's pretty remarkable,
Yeah.
especially in an industry as competitive as healthcare. It sounds like they're doing something right.
They are. And a big part of their success is their ability to negotiate lower drug prices.
Right. That's a hot topic these days. PBMs often get criticized for their role in the rising cost of medications.
Yeah, it's a complex issue, but UNH is trying to address those concerns. They're emphasizing their role in negotiating lower prices for their clients and consumers.
And they're committed to passing through 100% of the rebates they negotiate with drug manufacturers to their clients by 2028. So they're putting their money where their mouth is.
They are, and it's a move that could have a real impact on drug prices. It'll be interesting to see how it plays out.
Definitely. All right, let's shift gears to Optum Insight, their data and technology solutions segment. They brought in $19 billion in revenue in 2024 and are projected to hit $22 billion in 2025.
Yeah, Optum Insight is a really interesting part of UNH's business. They're essentially the brains behind the operation.
The brains. What do you mean by that?
Well, they develop software and data analytics tools that help healthcare organizations improve efficiency, manage patient populations more effectively, and ultimately deliver better care.
So they're kind of like the tech arm of UNH. But what are some specific examples of what they do?
Well, for instance, they help hospitals streamline their administrative processes, they help insurers better understand their risk pools, and they help providers track patient outcomes and identify areas for improvement.
That sounds pretty powerful.
Yeah.
It seems like data and technology are becoming increasingly important in healthcare.
Yeah, they are. And UNH is clearly investing in this area. In fact, Optum Insight has a $35 billion backlog, which indicates strong demand for their services.
Well, a $35 billion backlog. That's a pretty solid indicator of their future prospects.
It is. And it shows that UNH is serious about leveraging technology to improve the healthcare system.
Okay, so we've covered Optum Health, Optum Rx, and Optum Insight. Now let's talk about their core health insurance business, UnitedHealthcare.
All right, UnitedHealthcare is a behemoth. They're approaching $300 billion in revenue in 2024 and are projected to reach $340 billion in 2025.
Wow, that's just mind-boggling. And they're still growing. They're planning to add 1.9 million new members to their plans in 2025.
Yeah, they're a force to be reckoned with.
Yeah.
And they're showing strength across different market segments. They're doing particularly well in the self-funded commercial market, which is appealing to sophisticated buyers who are looking for cost-effective solutions.
Right, but they did face some challenges in the Medicare Advantage market in 2024, didn't they?
Yeah, there were some unusual benefit designs in the market that impacted their growth, but they seem confident about a rebound in 2025. They're projecting to add up to 800,000 new Medicare Advantage members.
So they're not backing down from that market. They're still seeing it as a key growth area.
Absolutely. And it's worth noting that they have strong retention rates across all their plans. They're even winning back former members, which is a good sign for their brand and the value they're providing.
It's clear that they're focused on building long-term relationships with their members. They're not just trying to churn and burn.
Right. They're in it for the long haul.
Yeah.
Okay, so we've talked about their four main business segments. Let's take a step back and look at their overall financial health and how they're using their capital.
Yeah, that's important. A company can have great products and services, but if they're not financially sound, it's all for naught.
True. So UNH deployed almost $17 billion in growth capital in 2024, which shows they're serious about investing in the future. They also returned over $16 billion to shareholders through dividends and share repurchases.
So they're striking a balance between investing for growth and rewarding investors.
Yeah.
That's a good sign.
It is. And they're projecting strong cash flow from operations in 2025, about $33 billion, which is 1.2 times their net income. That gives them a lot of flexibility to pursue strategic initiatives and continue their growth trajectory.
They're in a very strong financial position, no doubt about it. But let's not forget about the human side of healthcare. Beyond the numbers, what are they doing to improve the experience for consumers?
Yeah, that's a great question. We all know that healthcare can be a frustrating maze to navigate. So what is UNH doing to make it easier and less stressful for patients?
I'm all ears. Give me the details.
Well, for starters, they're investing heavily in their digital capabilities. They're seeing a big increase in the use of their mobile app, which allows people to manage their benefits, find providers, schedule appointments, and even access telehealth services all from their phone.
It's like having a personal healthcare assistant right in your pocket. So convenient.
Exactly. And it's not just about convenience. They're also using technology to streamline administrative processes and reduce the hassle factor. For example, they've seen a decrease in call center volume, which suggests that their efforts to improve self-service options are working.
Less time on hold, more time actually getting things done. I like the sound of that.
Yeah, it's a win-win for everyone. And they're also making the onboarding process for new Optum Rx members much smoother through technology. You know, switching prescription drug plans can be a real pain sometimes, but they're trying to make it as seamless as possible.
It sounds like they're really putting a lot of thought into the consumer experience, trying to make healthcare less of a headache.
They are. And it's not just about technology. They're also focusing on transparency, especially when it comes to drug pricing.
Right. We talked about their commitment to pass through 100% of rebates. But what about the bigger picture of PBM reform? There's a lot of scrutiny on this industry right now. How is UNH addressing those concerns?
Well, they're definitely acknowledging the concerns about high drug prices, and they're advocating for greater transparency in pricing practices across the board, not just within their own company.
So they're not just trying to deflect blame. They're pushing for systemic change.
Exactly. They're also trying to shift the focus towards drug manufacturers' pricing practices, arguing that PBMs are just one piece of the puzzle. It's a complex issue for sure.
It is. But it's encouraging to see that UNH is taking a proactive approach and trying to be part of the solution.
Okay, so we've talked about their financials, their growth strategies, their focus on the consumer experience. But we can't ignore the elephant in the room, the policy and regulatory landscape. This is always a big factor in healthcare, and it seems like there are a lot of moving pieces right now.
There are. And one of the biggest issues is PBM reform. As we've discussed, there's a lot of scrutiny surrounding pharmacy benefit managers and their role in drug pricing.
Right. Some people argue that PBMs are contributing to high drug costs, while others say they're helping to keep costs down. It's a bit of a tug of war.
Exactly. And it's an issue that UNH is watching closely. They're advocating for greater transparency in PBM practices, but they're also defending their own role in negotiating lower drug prices. It's a delicate balancing act.
So they're trying to walk a fine line, advocating for change while also protecting their own interests. It'll be interesting to see how this all plays out.
It will. PBM reform is a hot topic in Washington, and it's likely to have a significant impact on the healthcare industry. Okay, so we've covered a lot of ground here. Their financial performance, their growth strategies, their focus on the consumer experience and the policy landscape. What's the overarching message you're taking away from this earnings call? What's the big takeaway?
I think it's clear that UNH is not just a healthcare giant, they're a healthcare innovator. They're not content with simply maintaining the status quo. They're actively investing in new technologies, embracing new models of care, and pushing for systemic change in the industry.
They're not afraid to ruffle some feathers and shake things up. It's refreshing to see.
Right, and they're doing it with a long-term vision, recognizing that sustainable success requires a commitment to both financial performance and societal impact.
They're betting big on the future of healthcare, and it's fascinating to watch them navigate this complex and ever-changing landscape.
It is, and it'll be interesting to see what they do next.
All right, before we wrap up, it's time for our favorite segment. This is not financial advice.
Always a good reminder. So based on our deep dive into UNH's earnings call, what's our outrageous but plausible trade idea this week? Well, we've established that UNH is all in on value-based care, and they're not shying away from making bold moves. So what if they decide to go all in on the mental health space?
Interesting. Mental health is a huge and growing market, and it's often underserved by traditional healthcare models.
Exactly. What if UNH decided to acquire a leading telehealth platform that specializes in mental health services? They could integrate it into their existing network, providing access to a wider range of providers and services for their members.
That would be a game changer. They could become a one-stop shop for all things mental health, from therapy and counseling to medication management and support groups.
Right. And it would align perfectly with their focus on value-based care. By providing proactive mental health support, they could potentially reduce the need for more expensive interventions down the road.
It's a bold move, but it makes a lot of sense. It could give them a significant competitive advantage in a rapidly growing market.
And it could have a real impact on people's lives, improving access to much-needed mental health care.
Okay, so we're putting our money on UNH making a big splash in the mental health space.
Yeah.
But remember, folks, this is just us speculating. This is not financial advice.
Absolutely. Do your own research, consult with a financial advisor, and all that jazz.
Always. But it's fun to imagine what the future holds, right?
Totally. And it keeps us on our toes.
Well, that wraps up our deep dive into UnitedHealth Group's Q4 and full year 2024 earnings call.
Thanks for joining us on Talk Tickers.
We'll be back next time with another insightful breakdown of the latest earnings calls. Stay tuned. Okay, so we've talked about UNH's impressive financials, their commitment to value-based care, and their efforts to make healthcare less of a headache for consumers. But I'm curious, what are some of the key themes that really jumped out at you from this earnings call? What's the big takeaway?
Well, one thing that really stood out to me was their unwavering belief in the power of technology to transform healthcare. It's not just about automating tasks or making things more efficient. It's about fundamentally changing the way healthcare is delivered and experienced.
Yeah, you're right. We talked about their digital initiatives, but it goes way beyond just having a fancy app. They're using AI to streamline processes, analyze data to improve outcomes, and even personalize care plans.
Exactly. And they're not just talking about it, they're putting their money where their mouth is. They're investing heavily in their technology infrastructure, partnering with innovative companies, and even acquiring strategic assets to build out their capabilities.
It's like they're building a healthcare ecosystem powered by data and technology. And it's not just for their own benefit. They're talking about using these tools to improve the healthcare system as a whole.
Right. And that brings me to another key theme, their focus on collaboration and partnerships. They're not trying to do everything themselves. They're recognizing that they need to work with other stakeholders in the healthcare ecosystem, providers, payers, tech companies, even patients themselves, to truly drive meaningful change.
It's a smart approach. Healthcare is too complex for any one company to solve all the problems.
Absolutely. And UNH seems to understand that they're building bridges, fostering collaboration, and creating win-win scenarios for everyone involved.
It's a refreshing perspective, especially in an industry that's often characterized by competition and silos.
It is. And it's clear that UNH is trying to change that narrative. They're talking about shared goals, common interests, and working together to create a more sustainable and equitable healthcare system.
Okay, so we've got technology as a driving force, a focus on collaboration, and let's not forget their commitment to value-based care. This seems to be the foundation of their strategy.
It is. And it's not just a buzzword for them. They're truly trying to shift the focus from volume to value, from treating illness to preventing it.
And they're putting their money where their mouth is. They're investing in programs, partnering with providers who share their vision, and even structuring their reimbursement models to incentivize quality and outcomes.
Exactly. And it's a long game for sure. But if they can succeed in making value-based care the norm, it could have a profound impact on the healthcare system, improving outcomes, lowering costs, and ultimately creating a healthier society.
It's an ambitious goal, but it's one worth striving for. And from what we've heard on this earnings call, UNH seems to be all in.
They are, and it'll be fascinating to watch them on this journey.
Absolutely. Well, that wraps up our deep dive into UnitedHealth Group's Q4 and full year 2024 earnings call. It's been a wild ride through the world of healthcare finance, but I feel like we've come away with some valuable insights.
I agree. It's always eye-opening to peek behind the curtain of a company like UNH and see how they're shaping the future of healthcare.
Thanks for joining us on Talk Tickers. We'll be back next week with another earnings call deep dive. Until then, stay informed, stay curious, and as always, do your own research.